this can be also an essay question better. So let us do pharynx. So just if you look at this picture, maybe this specimen you found in the dissection hall also, isn't it? So what is this specimen showing us? This is median sagittal section of head and neck. Okay. So median sagittal section, that means you are finding the section is done in this way, in this direction. So you are finding this is frontal air sinus, right? This is nasal bone, okay, and we have cartilage. Then these are the conchae and metatarsus. Then this is hard palate, this is soft palate, this is tongue, this is mandible bone, right? Then
Madam.
yes, beta.
Okay.
Ma'am,
No, I'm
here
not.
is sphenoidal air sinuses, ma'am.
Sorry, beta.
Here. This is sphenoidal air sinuses, ma'am. Second sinus.
Here we are not, this is, yeah, very good. This is sphenoidal air sinus.
Sphenoidal air sinus.
This is sphenoidal air sinus. This is frontal air sinus.
Frontal air sinus.
This here what I am showing you on my face, this is maxillary air sinus. Okay?
Maxillary.
Maxillary
Yes,
air
ma'am.
sinus.
Maxillary air sinus.
Yeah. Now, see here, what is the name of this bone? Mandible. From here, what
Mandible.
is the name of the muscle? We have genioglossus. Genioglossus. Okay, now, what are these cartilages? I told you in detail. So, actually, these are laryngeal cartilages. This is thyroid cartilage, below thyroid cartilage, cricoid cartilage.
Required.
Cricoid cartilage will be narrow in front and lamina will be broad behind. This cartilage is epiglottis. Epiglottis. So this is the interior of larynx, which I have explained you. This is the sinus of larynx. Okay, try to revise the things once. So now, overall, now we are dealing with pharynx now. So that means the area which is behind the nose is nasopharynx. The area
Yes.
behind the oral cavity, you call it
Oropharynx.
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 Area behind
Laryngopharynx.
yeah, laryngopharynx. Okay, so pharynx is conical fibromuscular tube forming the upper part of air and food passages. The section we saw when we were doing deglutition in physiology also, and I told you it is like till aeropharynx we have like two tubes are entering, like you will see both esophagus is there and the larynx continuation is there, hence it is a pathway for both air and food. Okay, so it is length is 12 to 14 centimeters long, width is 3.5 centimeters at base and 1.5 centimeters at pharyngoesophageal junction. Okay, then so next what we have, see, this is the cut section of the head and neck region, what you also see in your respective colleges. Now divisions of pharynx. So when you just look at this, you will see base of the skull. So this is the base of the skull what we have. Okay. Then so base of the skull, and as Kirti was telling us, this area is for sphenoidal air sinus, and this particular whole area is actually called as basi-occiput. This point is basi-occiput. Okay. Then what is this bone? I said this is the plane of hard palate. This
Hard
is
palate.
hyoid bone, okay, in the lower border. So basically, we have three subdivisions, as you can see here, from the basi-occiput to this soft palate midline, you have nasopharynx. From the midline of the soft palate to the upper border of the epiglottis, we have oropharynx. Okay, this blue area is epiglottis, right? So from the extent of the epiglottis to the cricoid cartilage, we have laryngopharynx. Now, if you try to understand this picture, nasopharynx area is in communication with the nose, oropharynx area is in communication with the mouth, laryngopharynx area is in communication with the larynx. Okay, so pharynx is basically a tube which is carrying food, in fact, because pharynx continues with this tube. This is a dilatable stretchable tube. Can anybody name this tube where I kept the arrow? Food passage. Esophagus.
Esophagus.
Yeah, very good. Esophagus. In front, this is airway. Larynx,
Larynx, trachea.
very good. Trachea. Okay. Now, so structure of pharyngeal wall. Now, when you just see in our body, like when you just try to like cut the skull and see from outside to inwards, when you have seen in the cadaver, like when you have seen this specimen, the outermost covering what we see is actually mucous membrane. Okay. Then pharyngeal aponeurosis is this point where we have this soft palate. This is pharyngeal aponeurosis. Throughout this area, carefully observe my arrow, like where I am scrolling in front of the vertebrae. This point we will have muscles. These muscles are constrictor muscles. Okay, like in the carotid triangle, we have seen middle constrictor, if you remember. So actually, we have three constrictors. Here we have superior constrictor, lower down middle constrictor, still lower down inferior. Superior, middle, and inferior constrictor muscles continuation is esophagus. Continuation of these muscles is nothing but esophagus. Now let us see. So it has muscular coat. So A, B, C, one behind the other are actually the muscles, like we have superior constrictor, then we have middle constrictor, and we have
Inferior
inferior
constrictor.
constrictor. Okay. Then this pink lining what we have is one of the fascia in the neck. You call it as buccopharyngeal fascia. Buccopharyngeal fascia. If you remember, there is a connection between middle ear and nasopharynx. No, beta?
Eustachian tube.
Yeah, very good.
Eustachian.
Yeah, very good. Eustachian tube, also called as the auditory tube, or pharyngotympanic tube, three names. Okay, so the mucous membrane is basically in the upper part of nasopharynx. It is made up of pseudostratified ciliated columnar epithelium. Okay, see, important points only I will tell. I don't want to trouble you with unnecessary things. Okay, so here pharyngeal muscles we have. So stylopharyngeus, palatopharyngeus, salpingopharyngeus are the. We will see these muscles. These are higher up muscles which are being shown here. Now see here, this is the styloid process. So what is the meaning of stylopharyngeus? That means from the styloid process to the pharynx, the name of the muscle is
Pharynx.
stylopharyngeus. Stylopharyngeus. If you observe, there is one muscle which is running little horizontally, no, that is superior constrictor. Okay, so here we are discussing stylopharyngeus. Okay, now we know like we have hard palate. Okay, in the previous picture we saw hard palate, right? From the hard palate to the pharynx, you use the muscle's name as palatopharyngeus.
Palatopharyngeus.
Yeah, very good. Palatopharyngeus. Okay, salpingo means actually it is coming from the auditory tube. Okay, this is our auditory tube. Just now was what Kirti was telling. From the auditory tube to the pharynx, if the muscle comes, you call it as salpingopharyngeus. So to understand the orientation of this picture, basically this is skull bone. Okay, middle cranial fossa, the section has been taken. This is nasal septum. కిందికి వచ్చింది nose మధ్య. And you know, like on right side and left side of the nose, we have nasal concave. You remember? Shelf-like projections. Concave and meatus. So nearby muscles are shown. This is soft palate beta. ఇది ఉవ్యులా. మిర్రర్లో కూడా మనం చూసుకుంటే చిన్న టంగ్ లాగా కనిపిస్తుంది. Uvula. That means within this soft palate, we have certain muscles. Okay, one among them is salpingopharyngeus. Okay, these are the muscles.
Ma'am,
Yes, beta. Puram?
in muscles of pharynx, ma'am, we should remember this
No, no,
constrictor
no.
muscles or
Only for
this
information. Superior, middle, inferior constrictors you should remember, beta. Okay?
this muscles, ma'am, that salpingopharyngeus and all that. We need
No,
to
no,
remember
no.
this also.
It becomes little complicated, beta. That's why I didn't. You just give the names, but because they are also
Okay,
seen in
okay,
pharynx, no? So
okay, okay.
stylopharyngeus, palatopharyngeus, salpingopharyngeus, just name them. Once you name them, constrictors, the examiner will expect better from you, definitely. So we have three
Okay.
constrictor muscles. This is the view which is taken from behind, back. This is our skull bone. Okay. This is the level of pituitary gland. Okay, that means here we have the pituitary fossa area. This is the middle cranial fossa, the section has been cut. So that when you see from behind, you are finding first muscle is superior constrictor, second muscle is middle constrictor, last muscle is inferior constrictor, superior, middle and inferior constrictor. Further continuation, I told you. What is the further continuation of this muscle?
Esophagus.
Very good.
Esophagus.
Esophagus. Very good. What is the front tube? Trachea.
Trachea.
What is
Larynx,
the
trachea.
behind tube? Esophagus.
Esophagus.
That means we have
Esophagus.
two tubes. One tube is for airway and the other tube is for food. Front
Food.
tube
Food.
is for airway, behind tube is for food, right?
Food passage. Yes, ma'am.
Yeah, very good. Now see here, this is the styloid process. From the styloid process, you are finding one muscle is coming like this, no? To the pharynx. What do you call it as? Stylopharyngeus. There is one ligament also, you call it as stylohyoid ligament. Okay. Now the you are finding this median line, midline, white, little white line. Actually, this is called as median raphe, pharyngeal raphe, R-A-P-H-E. So this is the point where the two constrictor muscles of right and left side are coming and getting inserted. Okay, insertion. Superior constrictor, middle constrictor, inferior constrictor. All these constrictors are actually inserted in median raphe. We didn't see origins yet because this picture clearly gives us the information of this insertion. I'm showing you this. Now, from the base of the skull to the superior border of this muscle. Which muscle? Superior constrictor. You are finding there is one deep fascia of neck, this white layer. What is the name of this fascia?
Laryngobasilar fascia.
Pharyngobasilar fascia. Okay. Okay. Now, see, superior constrictor, it lies in the wall of nasopharynx. Okay. So from where is it coming? Posterior border of the medial pterygoid plate and the pterygoid hamulus. Okay. These are the words which you see in the skull bone. If you remember medial pterygoid plate, one more pterygoid plate we studied with muscles of mastication. What was that? Lateral pterygoid plate. From the lateral surface, lateral pterygoid muscle was originating. From medial surface, medial pterygoid muscle was originating. So medial pterygoid plate is now giving origin to the first muscle. Near to that, you will have pterygoid hamulus also. And this particular midline area, you call it as pterygomandibular raphe, you see in the mandible bone. Okay, and mylohyoid line also I have shown you in mandible bone. And mucous membrane on the sides of the tongue. So that is wide origin this muscle has, and the insertion is medial raphe. Okay. The lower part of the superior constrictor is obviously, you can see it is covered by middle constrictor. This is the lower part of superior constrictor, which is covered by middle constrictor. Okay. Now this second muscle what we are seeing is middle constrictor, which comes from the stylohyoid ligament. And we have hyoid bone here, right? So here hyoid bone is shown also, side view. So from the, this is the greater carnu and this is the lesser carnu. So from the greater and lesser carnu of the hyoid bone and from stylohyoid ligament, we will see the second muscle, middle constrictor is coming. And it is overlapped by inferior constrictor. That means lower fibers of middle constrictor are overlapped by inferior constrictor. Niharika, are you understanding?
Yes, ma'am.
Okay, please stop me if you don't understand. Now, the last muscle what we have is inferior constrictor. So this is the thickest of the three. When you compare superior, middle and inferior, the last one is thickest. And you see it is further subdivided into two parts. Okay, the upper part is called as thyropharyngeus and the lower part is called as cricopharyngeus. Okay, so thyropharyngeus means from the word you can just make a guess like it is coming from thyroid cartilage. Cricopharyngeus, from the word you can make a point like it is coming from cricoid cartilage, isn't it? So that is upper part is upper subdivision is like we have thyropharynges, which is coming from the oblique line of thyroid cartilage, and also from the inferior carnu. This is the inferior or the lesser carnu of the hyoid bone. Okay. Then inferior carnu of the thyroid. Cricopharyngeus, it is transversely placed and it is coming from the anterior part of the cricoid cartilage. One point of origin is enough. Okay. Now, cricopharyngeus muscles. Anyhow, when you talk about insertion, all the three muscles, where are they inserted? Median raphe.
Median fibrous raphe.
Yeah, very good. Raphe in the middle,
Raphe.
like that point. Okay. So muscles of the two sides, they act as a sphincter. So function is they are preventing the entry of air into the esophagus when we are swallowing. This point is enough better. Okay. Then so there is a word sometimes there will be a question which is called as Killian's dehiscence, a potential gap that is like between weak area of pharyngeal wall. That means if you have seen just now, so what is this cricopharyngeus? Thyropharyngeus is above one and cricopharyngeus is below one. So this particular area is not having much muscle fibers. Okay, so that particular area where we do not have much muscle fibers, it may protrude outside. It may just bag outside. It may form a pocket where anything can be stored. So that outpouching of this area may lead to some hernias. So this area is actually Killian's dehiscence. It's a gap between that weak area of pharyngeal wall where perforation. That means it may get ruptured also when we are trying to do endoscopy. Endoscopy we do know when a person, if we are suspecting some cancer, right? So when you are doing some esophagostomy or even we are doing some like investigative or surgical procedure, this thin area where we do not have much muscle fibers, this gets, this is prone for rupture, prone for rupture, risk of rupture. These are not required. Yesterday we got this question, right? Pharyngeal plexus of nerves. I said glossopharyngeal vagus. And also some of the nerves from superior cervical sympathetic ganglion. I also told you accessory, right? Spinal accessory. These all actually form network in the pharynx and they supply the pharyngeal muscles, right? So they form pharyngeal plexus of nerves. Okay, only you just name the nerves, that is enough. You need not go with other details. Okay, now this is actually an essay question better. All three pharynx we should know, like nasopharynx, oropharynx, laryngopharynx, their boundaries. Now let us see. So first we are talking about behind the nose, this area is nasopharynx. So it has roof. Which bone is this? Kirti, you have named it. What was that?
Sphenoidal sinus.
Excellent. Very good. Sphenoidal.
Ethmoid bone. Ethmoid bone,
No,
ma'am.
no, beta. The sphenoid bone only. Bone is also sphenoid.
Sphenoid bone.
You need
Sphenoid.
not change
Yes,
the
ma'am.
name of bone. Same bone. Basic
Okay,
occiput we
ma'am.
call it as. This whole area, though it is sphenoid bone, no, one special name is given. Basic occiput. Okay, roof.
BC also.
Okay. Then this is our posterior wall. What is this vertebra, beta? First vertebra you are finding. That means C1.
Cervical.
First cervical vertebra. Okay. In the floor, we will have muscles. What is the anterior communication? Nasal cavity.
Nasal cavity.
In the lateral wall, you are actually, I'll take you to very good picture. Previous pictures were good. You will see there is an opening. Introduction picture was much better, in fact. I'll take you to that picture only. See, in the lateral wall, there will be an opening like this. This opening is eustachian tube, isn't it? This eustachian tube is actually, as you already told me, connection between middle ear and nasopharynx. Here you are finding there is one fold, isn't it? Inverted U-shaped fold. That means this fold will have a muzzle. Okay, this, and you will have one tonsil also. You remember tubal tonsil? Yesterday when we have done Waldeyer's lymphatic ring, actually the tubal tonsil situation is this elevation only. Okay, tubal tonsil, lymph node will be here and muscle will be salpingopharyngeus. So this is the lateral bone. Anyhow, nothing to worry. I will elaborate each point. But before we go, I want you to use your brain so that you understand more. So now see here, extent is like nasopharynx is upper part and behind the nasal cavity. It is present like below the base of the skull and above the soft palate, right? Superiorly base of the skull, inferiorly soft palate. Okay. Then roof is formed by, just now I told you, base is sphenoid and base is occiput. This is occipital bone, this is sphenoid bone. Lateral wall, like posterior wall, first cervical vertebra. What is another name given to first cervical vertebra? Atlas. In front
At
of
last
the,
vertebra.
very good. In front of the atlas vertebra, you are finding muscles. We call them as prevertebral muscles. Prevertebral muscles. And covering the prevertebral muscles, we will have fascia, that is prevertebral fascia. Okay, so these are the boundaries of nasopharynx. Pharynx can come as an essay beta. You should know the boundaries of all the three subdivisions of pharynx, muscles of pharynx usually will be included, and any of these three subdivisions can come for 5 marks. Like for this question paper, one of the pharynx has come for 5 marks. We cannot say. Okay, so floor, how is this? This whole area is nasopharynx beta. So obviously this is floor. So what do you see there? Soft palate anteriorly, and behind you will see it is in continuation with the nasopharyngeal isthmus, this area. Okay, so anterior wall is in communication with nasal cavity, you can write, where we have the concha and metasis. Okay, shelf-like projections. This is the lateral wall. What is the opening we see in the lateral wall? Eustachian tube. Okay, eustachian tube you will see in the lateral wall. I told you above the lateral wall, what is that tonsil we have? Tubal tonsil. Above eustachian tube opening, we have one lymphoid tissue. You call it as tubal tonsil. And along with nasopharynx area, if you remember Waldeyer's lymphatic ring, yesterday's picture, in the middle I have shown you nasopharyngeal tonsil, tubal tonsil, palatine tonsil, lingual tonsil, isn't it? So this area is nasopharyngeal tonsil. This area is tubal tonsil. Okay, this area you can see palatine tonsil. Behind the tongue we will have lingual tonsil.
Lingual tonsil.
So all together round it forms Waldeyer's lymphatic ring.
Yes.
So now we are talking about that nasopharyngeal tonsil, which is situated near the roof and posterior wall of nasopharynx. Okay, only this point, because now you read nasopharynx, no? So towards the roof, what Kirti said, like sphenoid bone, base occiput, that area, and the first cervical vertebra area where we have prevertebral muscles and fascia, in that area, that means this area and this area will have lymphoid tissue. So this area, that what is that specialized lymphoid tissue? Nasopharyngeal tonsil, also called as adenoid. Adenoid. In case of small children, what happens? These adenoids get enlarged and there may be difficulty in breathing. When the baby is sleeping in this room, you will listen to the snoring in third and fourth room also. Such obstruction will be there in airway. Because of the obstruction of airway, you will see loud snoring. Okay, in case of adenoids. Then, so this is like, what is this sphenoidal air sinus? Sphenoid bone, base occiput. Okay, so ratificus pouch. You will get confused, beta. I'm just avoiding this, not required. Tubal tonsil, I told you it is associated with the opening of eustachian tube. You will see like a tubal elevation. It is a part of Waldeyer's lymphatic ring. This is the eustachian tube. Above this, you will have tubal tonsil. Okay, then sinus of Morgagni also will not be asked, beta. You need not worry. What are the structures? All these are like so many complicated things which you will get confused. See, this is our skull bone. Now you will correlate. This is the like frontal bone we have, right? This is anterior cranial fossa. We are finding brain. Okay, I told you this is pituitary gland. This is the area for sphenoidal air sinus. This is the sphenoid bone. This is base occiput. Here we have brain stem. Brain stem is coming into the vertebral canal, continuing as spinal cord. This is fourth ventricle. This is cerebellum, right? Okay. This is our pituitary gland. Behind the nose, this area is nasopharynx. This is all soft palate. This is soft palate A, uvula, that small tongue. Then this is our tongue, genioglossus muscle. This is B is epiglottis, right? Behind epiglottis, laryngopharynx. So this is the real specimen what you will have. Now coming to the lymphatic drainage of this nasopharynx region, it is draining into upper deep cervical nodes, retropharyngeal nodes, parapharyngeal nodes. Okay, three names you can remember. So it's actually like nasopharynx is found between the nose and larynx. It ventilates middle ear because it has eustachian tube connection, so that the air is actually moving from the middle ear to the nasal cavity. Okay. Notice. See, this is the uvula which I have been continuously telling. Uvula, uvula. So see here, beta. This is uvula, what I have been telling. This is hard palate. Hard palate's continuation is soft palate. This is palatine tonsil. So we have two arches. I told you yesterday. We have palatoglossal arch towards tongue, palatopharyngeal arch towards pharynx. Palatoglossal arch, palatopharyngeal arch. So whatever opening you are finding behind the tongue, that is where I kept the arrow. Behind the tongue is oropharynx. Exactly this point is the oropharynx. Okay. So now let us see oropharynx also we have certain headings. Roof. Now you will tell me what is roof in the oropharynx. Soft palate. Okay. Then posterior wall. You will easily tell me. Part of first, second cervical vertebrae. No. Then anteriorly it is in communication with what? Tongue. No. Anterior wall. Like we have tongue and floor. We are finding what is this cartilage? I said epiglottis. This is all lateral wall where we have pharyngeal muscles. This. Okay, now let us see. Everything will be elaborated. So oropharynx is extending from the plane of hard palate to the plane of hyoid bone. It lies opposite to the oral cavity. So boundaries are it has soft palate above, upper surface of tongue below, palatoglossal arches on either side, which you have seen here. This is palatoglossal arch on either side. Okay. Posterior wall. So posterior wall, which vertebrae we are finding? Second and upper part of the third cervical vertebrae. So this becomes second and this becomes third. That means till here we have oropharynx. Anterior wall is deficient above, and that means above we do not have any structures, whereas below you will have base of the tongue, where we have circumvallate papillae, lingual tonsil, and valleculae. That means the features what we find in the posterior one third of the tongue, isn't it? All those names you can write. Okay, that is the anteriorly the boundaries of oropharynx. Okay, now if you can recollect, now see this is sulcus terminalis. We have circumvallate papillae here. Okay, this is lingual tonsil. Okay, so if you remember from the tongue, I told you this is epiglottis, median glossoepiglottic fold, lateral glossoepiglottic fold. Between these two, we have the like folds which are called as valleculae, cup-shaped depressions. What we have there. Okay. So boundaries of oropharynx. Now this, where I am showing you this black area, this whole arrow is nothing but oropharynx only. So in the lateral wall, we have palatine tonsils. So what are the pillars? We have anteriorly palatoglossus arch. Behind we have palatopharyngeal arch, right? So the place where tonsils are placed is tonsillar fossa. Okay. So you can see front is palatoglossal arch with tongue. Behind is palatopharyngeal arch with pharynx. In between we have the tonsils. Okay. Now coming to the oropharynx lymphatic drainage, it's going upper jugular chain and then from there to jugulodigastric lymph nodes, posterior cervical group. So this area, oropharynx, is again it's a passage common for air and food. Okay, so helps in pharyngeal phase of deglutition. It also helps in speech because here we have tongue also. It helps in appreciation of taste because we have Valler's lymphatic ring here. It kills the microorganisms. Okay. Now, the last part of pharynx we are finding here now. That is laryngopharynx. Okay. Let us appreciate the cartilages again. I told you this is thyroid cartilage. Below we have cricoid cartilage. Cricoid cartilage is narrow in front and broad behind. This is arch and this is lamina. And this is epiglottis. Okay, and whatever space you are finding here, you call it as laryngopharynx. So lowest part of the pharynx, that means highest part is nasopharynx, middle is oropharynx, last one is laryngopharynx, which will be in continuation with what? What is this tube for food? Esophagus. And anteriorly, it is in communication with laryngeal inlet. That means the root see actually during the process of deglutition, what happens is epiglottis falls back. It comes in contact here like this and it closes this airway so that the food will be entering only into the esophagus. It will not be, this stretchable tube is nothing but esophagus. When food enters, it stretches. Okay. This fossa is actually important only, beta. So this is again, don't read anything. I'll try to show you pharynx from behind. This is, we are seeing from behind. We are finding nasal conche. This is septum of the nose, middle cranial fossa, skull bone this is. Okay, this is septum of the nose, conche and metasis, soft palate, uvula. You are seeing from behind, palatine tonsil. This is our epiglottis. Behind the epiglottis, you are finding two pockets. When we see from behind, two pockets are there. So these pockets are actually called as pyriform fossa or pyriform sinus. Okay. Sometimes it may be asked, because though it looks little difficult, you need to remember all the boundaries. Okay. So laterally, you will have thyroid membrane, thyroid cartilage. Medially, we will have ariepiglottic fold. One thing you remember, so like it's called as smuggler's fossa because in olden days people used to carry the precious
Diamonds.
diamonds. Diamonds.
Diamonds.
Okay. Here we have internal laryngeal nerve. Okay. Sometimes there may be certain things like cancers also in this area. Carcinoma. CA is carcinoma. Okay. Some referred pain may be there because same nerves here supplying will also supply ear. Vagus. Vagus is the nerve supplying both the areas. So referred pain may be in the ear. Link may go in less than 1 minute. I will send the link immediately. Join fast. Okay, you can see this is our pyriform fossa. Okay, so you can see this is behind the nose, nasopharynx, behind the mouth, oropharynx, behind the laryngeal cartilages, you have laryngopharynx, and surrounding this epiglottis, these pockets, pyriform